Hey everyone, like Rebecca said, appreciate you all for being here this evening. Know it's after work and ready to get to our families and everything, so thank you so much for being here. Tonight we're going to talk about the state budget and the upcoming special session where they propose to cut taxes. Um, and so if you've paid any attention to the state budget at all, you've probably heard that Arkansas right now has a very large, over $1 billion surplus. And that is true. But one reason that we have that is because the state either hasn't been funding or has been underfunding a wide variety of programs, programs that could both induce economic growth, but also help children and families at the same time. So that's things like infant and early child care, pre-K, after school and summer programs, safe infrastructure, and access to affordable healthcare, just those kind of things. And I think my friend Derek Lewis is going to talk a little bit more about some of the specific impacts he sees in his field in a little bit. But so, for example of what I mean, the state budget runs from July through June. So last year's budget that just ended in June was about $5.899 billion, the state budget. The budget this year is smaller. It's only going to be about $5.866 billion if they fully fund it. And I know that doesn't sound like a lot. It's only, $30-50 million on an almost $6 billion budget. But there's a couple of things to keep in mind that I think make it a bigger deal than it might at first seem. So the first thing to keep in mind, and this isn't true for every state, but it is true in Arkansas, is that our population is still growing. So, if you think back to some of the services I mentioned earlier, if you have more people in the state, you're going to spend more on infrastructure. If you have more people in the state, you're probably going to spend more on education. There's more people that need education. If you have more people in the state, you probably need to spend more on healthcare because there's more people that need healthcare. So one thing to keep in mind is that, that there's more people, there's a bigger need for public services as the population gets bigger. Another thing to keep in mind is inflation. So inflation is the general increase of the price of goods and services, which lowers the value of a dollar over time. And in particular, the cost of certain things rises faster than general inflation. Things like education and healthcare that the state has a big role in providing. So if you keep those things in mind, it's problematic that the budget is shrinking at all. But, especially if you consider inflation, arguably, not only has the state budget not been growing very much for several years now, but arguably, depending on how you measure inflation, it's actually been shrinking for a couple of years. It's definitely shrinking between 2021 and 2022, just in nominal terms. The budget is going down. But if you account for inflation, then it's an even bigger problem than it seems, is what I'm trying to get across. And so that has real consequences for children and families. I won't claim to be an expert in every single area of these public programs and services, but some of the statistics that I look at that are problematic to me, the share of children that don't have health insurance in Arkansas has been rising since 2017. That's a national problem, but it's worse in Arkansas and has been going on for longer. That's definitely something we could address if we use some of this surplus money to help people in need. The childhood poverty rate in Arkansas has been stagnant since 2017, around the same time. That's obviously problematic, especially if we're supposed to rely on the private sector to be addressing that issue. This is during a record economic expansion, and we still have more than 1 in 5 children in Arkansas living in poverty. That to me is saying that we're reaching the limits of what the private sector can do on its own. And those are just a few things. There's obviously more. We haven't increased spending on pre-K nearly enough or at all for a very long time. There's longstanding issues with people, thousands of families on the wait list to get community home and community-based services who really need it. And all this to say that we do have this money, over $1 billion that hasn't been allocated. But I think that all of those issues that I just mentioned, as well as more, I'm not saying that's exhaustive, but certainly we could address, the rising rates of uninsured children, stagnant childhood poverty, lack of access to affordable healthcare and education services. Those are all better ways to be using our money than another tax cut, a cut to the top tax rate again, which is going to mainly benefit the wealthiest Arkansans again. They've already been the main beneficiaries of several successive rounds of tax cuts. So that's kind of why we're here today, is to advocate for those things, and to hopefully get you all to raise this as an issue as well. And that was kind of I was trying to set you up there, Derek, if you wanted to knock them down.
You got to come off mute so people can hear you. Well, thank you for the opportunity to be here tonight. I'm Derek Lewis, I'm Executive Director of AMDPA, which is a long name of Arkansas Medical Dental Pharmaceutical Association. And so I work with physicians, dentists, and pharmacists across the state with care delivery, but policy and other things that relate to healthcare. I was asked to sort of share my thoughts on sort of how the budget will impact healthcare, and I'll let Bruno have all the numbers. I'll stick to more what we see at the clinic level and hospital level across the state, where I share my comments. And so, first of all, let me say, all these are complicated issues. There's no simple fix to any of this, and we have been doing surveying across the state. We've been doing some listening sessions, and one of the questions that we ask, if money is not an issue, what would you fix? And what's interesting about that question, they never say we'll fix diabetes or we'll fix hypertension. They go to the root of the problem. And so for me, as we're thinking about budgetary issues and items, to me, addressing social determinants of health is probably the number one priority for, I think, any state, but particularly a state that ranks fairly low in health as it relates to other states in the nation. Going with the thinking of investing in things that will improve social determinants of health actually reduces those underlying issues, the long disparities that we see in the state where we're ranked fairly high. I think it's going to be crucial. And so when you look at social determinants of health, things that impact your health actually are not things that you will see in the clinic office. So it's going to be investing in things that help prevent healthcare issues. And so investing in prevention care services is crucial. Again, particularly for a state that ranks fairly low in overall health. And so we're still in a pandemic. And so the pandemic, it didn't reveal I won't say any major new problems, but it sure amplified the problems that we do have in the state. And so one of the things that I think was a problem prior to, at least a strain on the healthcare system, is the workforce. And so as we look at the workforce, particularly in the pandemic, what we're seeing is a shortage of nurses. We're seeing burnout within our physicians. And so there is a tremendous amount of stress on the healthcare workforce, which puts stress obviously to the patients when they can't get in to see a physician or whatever the provider, let's say pharmacist or a dentist. And so investing in our healthcare force, and that's a long-term view. That's probably not saying we're going to invest in physicians, but it's probably our mid-levels where you have APNs and physician assistants, pharmacy techs, and then hygienists who can help undergird the stress that's on the workforce and healthcare. And so we're hearing, a lot about, there's a shortage in these areas. And so those are things that I think as we look at budgets, how do we look short-term and long-term? How do we expand the healthcare workforce, particularly for our aging population? How do we expand that? the public health system as a whole, and public health is what it really in the title. And so the pandemic is a public health issue. And so what it amplified, particularly in this crisis that we had, are really some inequities in communications, particularly across the state and some of our rural counties, rural areas. How do we make sure that messaging is clear and consistent in a way that it may be consistent, hopefully consistent in some of our larger cities like Little Rock. And so that public and really having a public health trust. I think that's the other thing that was revealed in sort of where we are. And so investing in those types of programs, I think is going to be very crucial. And I'm using the word investing instead of budget, because at the end of the day, the powers that be are going to create a budget. So what I'm graciously asking is that as they look at the budget, that they look at these not as savings, but really going to invest into a long term. The other two things I'll leave us with this is really infrastructure. And again, you hadn't heard me talk a lot about care delivery for patients, but really the things that impact health. And so infrastructure, first, I think digital infrastructure is, again, just beating up on COVID a little bit. Digital infrastructure is so key now as we rely on telehealth as a means of care delivery for many of our patients. As long as you have internet connection, good, you're okay. But as we get further out into some of my rural areas, that becomes an issue where you already have access issues in those areas because they don't have the facilities in a decent mile radius. And so telehealth, as we lean on that more heavily, depending on how long we continue in the pandemic. And so investing in digital infrastructure is going to be key. So that's broadband. That's not only broadband, but actually investing in the education of telehealth itself from a community standpoint and a workforce standpoint. And then the last would be what we call traditional infrastructure. And as we look at inequities across the state, as we look at disparities across the state, we have to look at infrastructure as really a key investment. So what are those infrastructures? So we had a bridge that was out for a while. That impacted, that was a major impact on health. You couldn't get supplies. Folks couldn't get to their healthcare providers. And so making sure our roads, our bridges, parks are key. Walkable areas, riding areas. And again, not in just fancy metropolitan areas, but really in areas that sometimes get lost in those discussions, I think are very important. Believe it or not, there's a water issue. There are water issues in certain parts of the state, in certain counties of the state. And if you don't have clean water, you think of these as international problems in other countries. But right here in the state, there's some water challenges. And so water is a major infrastructure thing that I think we need to take a look at. And so those are my comments. Again, I think they're pretty broad, and I don't think I've shared anything that's new with anyone, but I'm hoping that those that are responsible for budgetary items and coming together and thinking that they'll think about those things, maybe as they had in the past.
Thank you so much, Derek and Bruno. Really appreciate it. I think, the underlying point both of you were making is that our state has been continuously underfunding a wide range of critical programs for people in the state, but yet they continue to take money away that they should be spending on those programs to put towards tax cuts, largely that benefit the wealthiest Arkansans instead of these programs that benefit everyone. And so we are working with y'all today to help raise awareness about this. And so now we're going to move in to the action portion of this, where we'll start letter writing and things like that. But did anyone have any questions for Bruno or Derek before we started that? Great, everyone's ready to go. Well, I appreciate it. So what we're gonna do this evening is 3 different actions that you can participate in, and all of them are optional. So if there's a different action you'd like to take during that time, you're welcome to do that. But we're going to start by writing letters. So we have a action alert that you can type in your address, and it will automatically populate with your state senator and state representative. And there's sample language there that you can edit and customize to your interests and what you think the state should be investing in more and how that impacts your community, and that they shouldn't be spending this money on these tax cuts. The next action will be posting on social media to raise awareness with your friends, family, colleagues, maybe people, other people, whoever you're friends with on social media, to raise awareness about this, because a lot of people don't know that this is happening when other big issues like redistricting are coming up soon. And the last activity is to send a text. So those would probably be your closest friends and family member who you feel comfortable texting. And so we have those 3 different options. And again, if you don't feel comfortable doing any of those, that's totally fine. You can do something else during that time to help raise awareness, tweet, whatever. And I'm going to put, right now, I'm posting the action alert link in here, so you can click on that and take the action alert. I'm going to be playing music for a few minutes while you're writing. And when you're done, if you could go to your reactions and do the thumbs up reaction, so I know you're done, so I can kind of see if people need more time or not. We're going to start the first action, which is writing your state representative and state senator about why this issue is important to you and your community. Any questions? Okay, thank y'all. We'll start that now.